Yeah, we don't need the slides for the objectives to talk a little bit about what we're going to talk about tonight. But tonight I want to go through a couple of the objectives um, that we're going to be going over, just understanding what advanced care planning is and why it's important, and defining some key words and terms so that when you're in a critical situation, you might hear some key terms that you have never heard before. So hopefully tonight, hearing these things and having those explanations will help you with your loved one and some of the things that the providers might be saying if you're in the hospital in a critical situation. We're going to talk about some tools to help in having these conversations and review some documents that are needed for advanced care planning. We're also going to talk about identifying characteristics of having an effective healthcare agent and how to choose that person. Also understanding the requirements for advanced care planning documents, and finally who to contact for more information and how you can get assistance in completing advanced directives, because we don't want you to be out there on your own. We want to be able to have someone that can sit down with you and go over them with you if you need some help with it. So, and Christina, you just want to let me know if they do come up on the screen?
It just came up, Jackie.
Oh, perfect. All right, let me move mine here. Awesome. Thank you all so much. It worked yesterday. I don't know why it's not working today. All right,
so we're on the
next slide.
We're on the objective slide.
Okay, we're done with that one. So I know a lot of people, you can go forward, please, thank you. So I think a lot of people hear about advanced directives, healthcare agents, advanced care planning. So what is advanced care planning actually? It's an ongoing process in which patients, their family, their loved ones, and the healthcare providers are all reflecting on what the patient's goals, what their wishes are, what their values are, and their beliefs. You talk about how these goals could direct their future medical care. You want to create a document that accurately reflects these choices so that everybody's on the same page when it comes to a critical situation. It provides documentation to all parties ahead of a medical emergency. And really having these conversations with your loved ones is just as important as writing things down. So if you have these conversations but you don't complete the document, that's great that you're having the conversations, but if you don't have those documents, if something happens and you can't be found or you can't be reached, if we have the documents here at the hospital, the providers know what needs to be done and what the patient would have wanted to have done. A lot of times you might have the documents completed, but you haven't talked to anybody else in the family or your loved ones or whoever you have as the medical power of attorney to make those decisions for you, and they're surprised, and so they don't know about them. So it's really good to have these conversations, but also have the documentation done. And having conversations, I really feel like a gift that you can give to your family members or your loved ones. You're helping, giving them some guidelines as to what you would want to have done in a difficult situation. There is proof that there's a difference when these conversations happen. There's really a difference is made, because studies have shown that when someone passes away, that having had these conversations, there is a depression rates really plummet. And people that are left after someone passes away, the grief is not as does not resonate with them as much. Studies have shown these things because they feel a little bit more at peace that they were able to make these decisions based on what their loved one would have wanted, and it gives them a little bit more peace. One thing that I found with my son, who was writing an article for the Frederick News Post, he sat down to do an advanced directive so he could write about it from a younger person's point of view. And it was interesting, some of the things that he wrote about. But two quotes that he had in the article that I didn't get to see until they were printed. One was that one quote that he made was that I'm sorry, one of the slides aren't on here. But one of the quotes that he made was here we go. One of the things that gave him solace with his death is that my mother and aunt knew exactly what he wanted before his grandfather died, and they were able to give it to him. And then also, he said that I miss my grandfather, my other grandparents who have since died, but our family stuck together through all of those deaths. And knowing what people wanted when they died is a big reason why. And I think having that peace, I know for me, knowing that sometimes after my dad passed away that I would think, did I really do everything that he wanted? Did I really care for him the best way that I could have? And did I do enough? And reflecting back on what his wishes had been and what his advance directive said, it gave me great peace afterwards and really helped my grief process. All right, can you go to the next slide? And the next. So some of the key definitions when we talk about advance directives is an advance directive is a written, verbal, or video document of a person's wishes regarding their preferences for medical treatment and who is to make their medical decisions should the patient be unable to communicate decisions themselves. So this is an actual document. Some people give a written document, some people do a verbal document, and then there's also video documents online that you can do that a lot of people would rather, write out a letter, or they would rather do a video so that that can be shared with other ones. As long as it's documented and witnessed, you're good to go. A healthcare agent, sometimes it's called a proxy or a medical power of attorney. It's also called, some people have called it a durable power of attorney. You can see why it can get confusing because there's so many different terms that people use. But this is a person chosen by the patient to make medical decisions when they're unable. A living will is a written expression of medical preferences or instructions. And then a surrogate is a person identified by default for medical decision making when there is no prior documentation of wishes. Next slide, please. So one of the things that I think a lot of people are surprised sometimes to find out is that there are, when they've done studies of this, 9 out of 10 people say that they do feel it's important to talk to their loved ones about their wishes, but only about 3 out of 10 people are actually having these conversations. And the Conversation Project has done studies that show that 95% of Americans say they would be willing to talk about their end-of-life wishes, and then 53% said that they would even feel relieved if somebody asked them about their end-of-life wishes. So a lot of people aren't really bringing it up, but it sounds like a lot of people want to talk about it, but it's just not a lot of discussion about it. And approximately 88% of people say they want to die at home, but only about 20% of people actually die at home. So we're not really getting this quite right yet. So how do we address this? Next slide, please. So it really is all about conversations, and like I say, it really truly is a gift that you can give your loved one. Next slide. So one of the things that we started at the hospital and in our community, we really took notes from something, it's a national project called the Conversation Project. And their goal is to teach people how to hold kitchen table style discussions with their family and their loved ones before a medical crisis occurs, so that what matters to you when it comes to end-of-life care is known by everyone. And one of the things that we see at the hospital, and I've seen when I have worked out on the medical units in an ICU, is so many times family members are being pulled apart during a time when they really should be pulling together. Many times there's family disagreements, people don't remember things the same way, there's confusion, turmoil that really has torn families apart during the time when someone is in the hospital, and it lasts long after the hospitalization. So we really encourage trying to have these conversations ahead of time when stress is low, options can be talked about and considered. So a lot of times somebody will say, I remember mom said this, but then somebody else said, no, well, she told me this. So if you have a document in hand, everybody's on the same page, and things just go so much more easily here in the hospital, and the providers have a little bit more of an understanding of what the patient's wishes were. Next slide, please. So the conversation can be pulled up. You can Google it online. They have the most amazing free tools I've ever seen on a website. They have something called a Conversation Starter Kit. And involved in this kit, they have a lot of different ways to bring up the conversation, different questions you can ask. They also have a document on how to talk to your doctor about what your wishes are. They have all different translations, different languages. I think the last time I checked, they had at least 10 And then they also have a pediatric starter kit because unfortunately there are times when our children need to have these conversations if they have chronic or terminal diseases. They also have a kit for families now. This is one that they came up with in the last, I think, 4 years ago, a kit for families and loved ones of people with Alzheimer's disease or other forms of dementia. Next slide, please. So one of the things that's on in these tools is just starting to have the conversation. And I think a lot of times if people don't start with the actual medical piece in the advanced directive, which sometimes can be a little overwhelming, talking about whether you would want a feeding tube, whether you would want to be on a ventilator, just start talking about, what really matters to that person at the end of life if something would happen to them. And advanced directives are for anyone, anyone over the age of 18. So we want to encourage people to have these conversations far ahead of having any chronic or terminal diseases or diagnoses, because really anything could happen at any time. Some of the things that we've learned through some of the workshops that we've had, people have said things that matters most to them is that they want to say goodbye to everyone I love, have one last look at the ocean, listen to some 60s music, and go. Other ones have said peaceful, pain-free, with nothing left unsaid. Pets are extremely important to people. They want to have their dogs laying next to them. The one said, I want someone to wash my face every day and reapply my lipstick. Those little things, finding out what's important to people will bring you so much peace. Knowing that my dad had a favorite blanket, we made sure that we had his blanket with him, blanket laying on him. With my mom, the part about the lipstick really resonates with me, knowing that she looks nice, and that's really important to her. She's told us what she wants to wear and how she wants to look, and she's been that way all her life, so we want to make sure that she knows that we're going to be taking care of her in that way. So it really does help to have these conversations and find those things out. But the one critical piece is how to bring up those conversations, because, with the studies that I talked about before, that people do want to have these conversations, how to bring them up, because, not everybody's comfortable with bringing it up. So some of the things that we have said before, like I have used in my own life, is if somebody in the family went through some critical situation or was on a ventilator, I will bring that opportunity up and bring that up to my family and say, Uncle Rick had this happen to him, and we've never really talked about, would you want to be on a ventilator? Would you want a feeding tube? What kinds of things are you looking for in these kinds of situations? With my dad, he was diagnosed with cancer, and I didn't want him thinking that we were giving up on him, but I also wanted to know what the backup plan would be if things didn't go as planned. So just bringing that up to him. And I think even with me being able to talk with people here at the hospital, when I first had to bring it up to my dad, who's a very positive person, jokes all the time, it was really hard. So it made me realize that we really need to give people some ideas of things to say when we have these presentations, because it's tough to bring it up, especially if you haven't brought it up before. So when he got diagnosed with cancer, I said to him, we're going to fight this as long as you want to do that, and I'm going to support whatever you want to do, but I want to have a backup plan, just knowing that if something would happen that you can't make your own medical decisions, we need to talk about just a couple of things. And he was able to get through that okay without, he would still joke about things, and it can actually be a really great conversation when you really ask that first or second question. Then it sort of eases into a really, sort of a comfortable conversation that you can have. But bringing up those first two questions, that was the hardest thing I've probably ever had to do. So I feel for people that, say these are hard to bring up. But just saying, that if you're diagnosed with a certain condition or a diagnosis, or if you tell your family, I heard this presentation last night, I'd like to make sure that you guys know what I want to have done when the time comes. Bringing that up to families, they might feel a little bit uncomfortable at first, but they are really going to feel blessed if something would happen and you've had that conversation. Next slide, please. So after you've actually had the conversation, then let's talk a little bit about what kind of documents will need to be completed. Next slide, please. Choosing a healthcare agent is probably one of the most important things that you'll do with doing your advanced care planning documents. But just breaking down all of the different documents involved in advanced care planning, because there's so many different things out there, I think it does get confusing. So you can do what we call advanced directive. Actually includes two parts. One is a living will, and you can do the living will by itself, and you can do the healthcare agent by itself. They're two separate pieces. They're at the hospital. At our hospital, they're the same document if you're using our document. But the living will involves instructions for the future care, things that you would want to have done in the future when you can no longer make your medical decisions. But it involves three things. A lot of people think, well, if I sign a living will and I'm in an accident and, you know, there might be a chance of me surviving, I don't want them to, you know, look at my advanced directive and think that I don't want anything done. An advanced directive only comes into play, the living will only comes into play if you're in a terminal condition, or if you're in a persistent vegetative state, or if you're in an end-stage condition. And in all of the advanced directives, it has those things, even a little bit more of a broader definition of those things. But those are the only times it comes into play. If you come into the hospital and you're not in any of those conditions, the doctor will treat you like they would anybody else. They'll have those conversations with you along the way, but they will not even, they'll look at your advanced directive when you first come in, but they won't be pulling that out to look at it unless you are in one of those three conditions. The living will does not guide the EMS personnel that come into your home. You have to be in the hospital to be able to, for them to utilize the living will or under hospice care. It does not guide your inpatient treatment. It does guide your inpatient treatment, but it does not require an attorney or notary, which we're going to talk about in a little bit. The difference between the living will and then a MOLST, some people have heard about a MOLST form. This is medical orders for life-sustaining treatment. And the MOLST form in Maryland is doctor's orders for current treatment, things that you would want to have occur right now. And basically it is talking about, do you want to be resuscitated? Do you want to if you are at home or if you're in a skilled nursing facility and you need to have blood transfusion, do you want to come back into the hospital? Those are the kinds of things that the MOLST covers, very different than the actual living will. And then your healthcare agent, you can do the living will separately, or you can do the healthcare agent separately, but it's best to do both because you have your sort of your guidance of your medical, what you would want to happen medically with your living will, but your healthcare agent would be the person that if they're following your living will, but they still have medical questions, because it's not all black and white. There's certain times that things happen that what you have written in the living will may not cover everything. So they may need a person to talk with about that. The healthcare agent is a person that you choose to make healthcare decisions when you're unable to make decisions for him or herself. They talk with the doctors, they view medical records, they give consent. They are bound to make decisions according to the patient's wishes. It does not afford the agent the ability to conduct financial business on your behalf. There's a lot of confusion over a healthcare agent, a medical power of attorney versus your financial power of attorney. So doing both is really the best practice, because that way you'd have somebody that they can go to answer those questions. And we'll talk a little bit about, choosing a healthcare agency in a few minutes. And then a financial power of attorney is a person who will conduct business on your part. They would be able to pay bills for you, sell property for you if you're unable to do so. So that's the biggest difference between the financial and the healthcare agency. Most times, unless they've been given if it's in the document, they usually don't make healthcare decisions for you unless it's been included in that document. They can be the same as your general power of attorney and your medical power of attorney. And generally recommended that you complete the financial power of attorney with an actual attorney. And it must be completed by a patient with capacity, your financial power of attorney. Next slide, please. So how does one choose a healthcare agent? The person has to be over the age of 18, and they do not have to be related. I think a lot of people think that their family member is the only person that they could have be their healthcare agent. And you really need to think about that a little bit. You want to think about someone who knows you the best, who knows you well, who understands what's really important to you. That may be a family member. That I had somebody that had their best friend from college because they knew that that person wouldn't, have a hard time at the end with following her wishes, and she felt like her family would. They have to be someone that's agreeable to having these conversations with you. Some people just want to avoid it. They don't want to have these conversations. Somebody that's willing to speak up for you and be your advocate. Somebody that can separate their personal feelings to make sure that they will represent your own wishes. Somebody that's available. Will this be to, somebody that won't be able to have time for this in their current lifestyle? Are they reachable? And who's able to manage conflict? Because sometimes you may have these documents in hand, but other family, other loved ones may, we just had a situation the other day where a husband had to make some really tough decisions for his wife, and her sister was here at the hospital and really, giving a lot of her opinion, and he was able to stand tough with, these are the decisions my wife wanted, this is what she wanted. But it was a little tough for him to do, but he was able to, really be her advocate and stand up for her. Next slide, please. So for an advanced directive to be legal, I think a lot of people feel that you have to complete it with a notary or an attorney, but that is not required in the state of Maryland. It only requires that that you have two witnesses. They have to be over the age of 18. They cannot be your healthcare agent that witnesses, the person that you're having make your decision, and they can't benefit from your passing. So it can't be a family member that would benefit from that. Maryland will accept all advanced directives completed from other states. If you complete one here in Maryland and then you go to another state, they also will usually honor those. I've not heard of any situation that they don't honor those. They're just so glad that someone has an advanced directive, so they will use them from other states. If you have any questions about that, if you are traveling, you may want to pull up www.caringinfo.org, and they have state-specific information for you there. Next slide, please. So what should I do? After you've talked about it, you've had these conversations, you've actually gotten the documents completed, what do you do with those documents? Because throwing them in a file cabinet that nobody can find or nobody knows about, it's just not helpful. It won't help you, in the long run. So you want to make sure that you give an original signed and witnessed copy to your primary healthcare agent. I would suggest if you have a secondary one, because there is a line for a secondary healthcare agent, you want to make sure they have a copy as well. I also suggest that also if you have your primary healthcare agent, say you have 4 children and you have your primary healthcare agent is your oldest or your youngest or whomever, I would also make copies for the whole family. Here in the hospital, when a family member doesn't know that someone else was made the healthcare agent, it really makes it uncomfortable for that person that is the healthcare agent. So if you feel that you can really actually have those conversations, or at least make copies for everybody, send them out in an email or give them copies, and just try to explain to them that maybe so-and-so is here locally, that you feel that they might be better. Just whatever reason that you chose that person, just try to share that if you can with your family members. The most important thing is if you feel that you can't share it with the other family members, please still do the document. I think a lot of people get to that healthcare agent part, they get to that first line and they're like, how can I choose between my children? And it's tough because I've had to do the same thing. But I made the best decision that I felt possible, and I shared that with both my children. And at least let the one person, the one healthcare agent that you've made the healthcare agent, at least make sure they have a copy and that they're aware. Please don't let it not make you not complete the document. You also want to keep a signed and witnessed copy of your advance directive in your red folder on the refrigerator. We're gonna, I think the next presentation, the next time, they're going to be talking about our red folder project in the community. And I don't know if anyone can see me, but this is our red folder, and it's a magnetized backing that you put on your refrigerator, and you put all your important documents in there. Some people also keep it in the glove compartment of their vehicle, because that way if they're coming into the hospital or if they're traveling, they have it right there with them. Make sure if you are traveling to put it in your suitcase so that you have it with you. You can also keep it in your file cabinet or fire safe box at home. We also suggest to make sure that your family members and friends have them, any alternate or secondary healthcare agents. Most importantly, your hospital, your primary care provider, any specialists that you may have, if you go to a cardiologist, a nephrologist, make sure that they have them as well. And then also in our advance directive here at the hospital, we have a little card that you can put in your wallet that says you have an advance directive. And that way it has the person to contact in the event that you have an emergency. And then reviewing these documents every few years is really helpful because that way you're staying on top of, you know, what your decisions are. Do you still feel the same way? You may change your mind about things. You may decide to make someone else, you know, your primary healthcare agent. Maybe someone has passed away that you had originally made your healthcare agent. And then also just continue having those conversations with loved ones because things may change along the way as to how you feel about things. Next slide. So some of the things that people will say when we talk about advance directives is, you know, I'm healthy and young. Do I really need to think about this right now? But every person over the age of 18, we encourage to complete a directive because really accidents happen all the time and you never know when something may happen. One of the best quotes that I heard, I think it was through the Conversation Project, was, it always seems too early until it's too late. And isn't that the truth? Because so many times we think, we'll have time to talk about that. We'll have time to think about that. And then someone's laying in ICU and the family is there and they're like, gosh, I wish I would have talked to my mom about this. I wish we would have had this conversation. Because it makes you, and if you think about it yourself, it sort of just causes turmoil inside of you when you think, I didn't really talk about this with them. I don't know what they would have wanted to have done. And when people don't know what their loved one wanted to have done, they err on the side of doing everything. And that may not have been what your loved one wanted. Sometimes people will say, you know, we've talked about it. Why do I need to write it down? I know what she wants. I've talked to my husband. I know what, you know, he knows what I want. But there's so many times where someone can't be reached or they're unavailable. Or the biggest thing that I think is most important is that, you know, you might have talked to your husband about it, but your children are there and they may be saying, well, mom told me this or dad told me that, and not everybody knows, you know, what somebody might have actually said. But if it's documented, it's all right there in black and white. Next slide, please. And then some people will say, I'll just leave it to my family to decide. But a lot of people don't know, and we work with patients and their families a lot here in the hospital. When someone is no longer able to make their own medical decisions, they think, oh, well, my son, you know, he's the oldest, he can make the decision. But that's not how the law hierarchy works. If someone does not have a medical power of attorney, they will look first to see if they have a guardian that was set up through the court. The next person will be the spouse or the domestic partner. They will next go to adult children. Now, something that people don't know is that if there is no medical power of attorney, if you have 4 children, all 4 children need to agree on everything. So if you're deciding one, do you continue to keep mom on a ventilator, or do we need to get a feeding tube? Do we need to decide on a feeding tube? All 4 children need to make that decision. And I always use the example that my husband has 3 other brothers, and I've never known them to agree on anything all at the same time. So thankfully, my mother-in-law has her wishes written down so that it's all right there in black and white, so that that can help them, bring them all together so they're not torn apart trying to decide on this. And then parents of the child, if they're of the patient, if there's no adult children or spouse or guardian. And then they go next to adult siblings, and then any other relatives or friends they look at for surrogate decision makers. And next slide, please. And then a lot of people, like I was saying, they'll say, well, they'll know what to do. And you really have to think about, will they? And will they all agree? If you have 4 children that have to agree, well, do you think they will all agree? Some people feel very differently about end-of-life care than others do. Deciding in the dark is extremely hard. It's so difficult to watch these families have to make these decisions and just hesitate because they don't know what their loved one would have wanted. And making decisions under stress is so much more difficult. And people have said, I remember talking about this, but I can't remember what mom said she wanted. Or the worst part is when one sibling says that mom said this and another one said, well, mom told me that. So, but really just that lasting burden that did we make the right decision, should we have done something different, can just linger on for so long if you don't know for sure. Next slide, please. So Maryland does not specify the use of any specific document or form. Some people have actually completed a letter. They put it into a letter, and as long as it's witnessed by 2 people, they can utilize that letter. You can attach additional pieces of paper or resources to an advance directive. I've actually written quite a bit on my advance directive, but I've actually added a letter to for my children and my husband, so that if one of them aren't here, that they have just a listing of things. There's certain physicians that I would want included in my care. There's certain people that in my life here at the hospital and personally that I value their opinion. I don't want them making a decision, but I think I know a nurse that has been, 30 some years here at the hospital, has been my go-to person to help me with, understanding certain medical things, medical diagnoses and things like that. And so I have her name down so that my husband and my children can call her. They know her already and they can call her. So any little things like that that you want to add in is perfectly fine. You don't have to stay within the lines of an advance directive. You want to make it your own. You want to make it what's important to you. And I've actually added some things into for my kids because it's going to be hard. And I want them to know that whatever decisions they make, I know that they're going to make the best decisions based on what they've heard me say and the things that I've documented. So I put some little funny things in there to try to, make it a little bit easier for them. And this is a voluntary document. You don't have, like I said before, you don't have to complete both parts. You can complete just the living will or just the healthcare agent. An advance directive does not expire. It can be updated at any time. And then also you can find our advance directive on www.frederickhealth.org/ACP. And we'll send out these slides for you as well in an email so that you can have these links so that you can go in and get the advance directive. Next slide, please. So these are some resources that we use quite a bit here, and that will include those in the slides that we send to you. My directives was down here at the bottom was something where I was talking about doing a video. You can do a video and upload that to mydirectives.org, and that way they actually have a video of what you're telling them that you would want as your wishes. Next slide, please. So like I said before, we don't want you to be alone in this process because I've completed advance directives. I helped my family members complete advance directives. I've helped my grandmother complete a MOLS form. And I often think, how do other people that have never done this before or haven't helped other people do this in their career complete these? Because it can be a little bit complicated. It's something that I think you really need to talk out a little bit. So here at the hospital, we're so blessed that back in 2015, our CEO came back from a conference and he said, in La Crosse, Wisconsin, they have 95% of patients have advance directives completed. And he's like, how did they get that done? So he really gave us the sort of the initiative to go out into our community and here at the hospital and try to spread the word about completing advance directives and how important it is to complete them. And so we started this back in 2015, and I thought to myself, I don't know how we're going to do this. I don't know how we will really get people talking. But it's been so exciting to watch this grow. We used to go to, or we still do, but the Elder Expo at the fairgrounds years ago when I started this whole initiative, we would take advance directives and our red folders, and people would come up and we would explain it, and they wouldn't really know what we were talking about. And then 2 or 3 years later, I realized people were coming up and asking for second ones and said, oh, my mom has one of these. I want to get one for my aunt. And people knew about them, and people were completing advanced directives. So it really has ignited the conversation here at our hospital and then also in the community. So it's really been exciting to watch. But our hospital has dedicated people to really actually have these conversations with our patients here and out in the community. I have Michelle Ross's name here. She's our advanced care planning social worker for our hospital. But when you also come into the hospital, we have navigators, nurse navigators that will come and sit down and talk with you and talk about goals of care with you. But out in the community, we have Michelle, we have Laura Berman they're going into our skilled nursing facilities to help people complete advanced directives, or to even at least have those conversations. Some people may not be ready to complete them, and that's okay, but just having those conversations so that you can at least start the process and start thinking about them is something that our hospital has dedicated our given commitment to do for our community. And so it really has been exciting to see that grow. So Michelle's information is here on the screen, and they'll be sent out with the slides, but please contact her because she can come, she can meet you either here at the hospital and the care clinic. I think she's doing home visits now. Our supportive and geriatric team are going out into the homes, so they can be available to you. It's just a great resource, and I always suggest having somebody sit down with you to help you work through the documents, because it can be a little bit overwhelming, and we don't want people to feel so overwhelmed that you don't feel comfortable completing them, because it really is a gift to you and your family. Are there any questions that anybody might have? I don't know if in the chat here.
Yeah, Jackie, we're starting to get some. Thank you. That was a wonderful presentation. I so appreciate your passion and sharing that information in a way that's really understandable. So someone has asked, Jackie, does the MOLST form have to be signed by a doctor to be valid?
That's a great question. I'm glad you said that. I should have covered that. The MOLST form does need to be completed by a provider. It used to be just a physician, but it now can be completed by a nurse practitioner or a physician advisor. But the advanced directive does not need to be signed by a physician or a nurse practitioner or anyone, but the MOLST form does need to be completed by a physician. Yeah, great question.
And Jackie,
and all the physicians know about them now. They usually have them in their doctor's offices. If they don't, some physician office practices, we have embedded case managers in the physician office practices now, and they will have them. So just ask the doctor if they have them there, or contact Michelle, and we can make sure you get one.
And Jackie, just to clarify, that was nurse practitioners, physicians, and physician assistants. And if you wanted a physician assistant to come to your house, you could call
physician
Doug
advisors
Brown.
in our department. Yes, you're right. Physician assistants. Thank you.
Yeah. So Mason Dixon can bring the MOLST forms to you and can help fill them out for you at home. And Jackie, I want to reiterate it because it comes up here at Daybreak. Really, that is the only form that EMS or a medical provider could honor if your wish was not to have CPR. If you don't have that MOLST form ready to give EMS when they come to your house, they have to initiate CPR, correct?
That is correct. And I probably missed that when I was going over the one slide, but you'll see it when you receive the email with the slides in it, where it had each of the documents sort of separated out. The difference between the MOLST and the advanced directive is the EMS cannot use the advanced directive, but if you have them in the red folder, they'll bring them into the hospital, so they're right there. But the MOLST, that is something that the EMS does recognize and they can use. So that is an extremely important point. Thank you.
Jackie, what happens if you don't necessarily agree with the decisions that your loved one is making? How do you navigate that?
That is really tough, but you have to be the kind of person and it's so funny because my mom will say that my stepdad wants cremated, and she doesn't agree with that. And I've told him, I will assure you that if that's what you want, you will be cremated. So, and we joke about that. And I think sometimes, trying to lighten up the situation a little bit will bring that conversation around. But at the same time, you sort of have to take yourself out of that picture, because it really is all about this person and what they want. Now, if they might be confused about something, because, if somebody wants to be on a ventilator. You need to make sure that they understand what that entails and what that means, and that's where your physician comes into play. You want to make sure, or Michelle, or a nurse navigator, you want to make sure that they understand what that means. What does it mean to be on a ventilator? One thing that we do here in ICU that I really like is that it used to be patients would go on a ventilator and we would provide support to the families, things like that. We have a nurse case manager now that has these conversations with the families that are making these decisions, and she will explain to them that, you know, if someone cannot be taken off of that ventilator, or if they have a feeding tube, or if they have a trach, if they, you know, need to keep a trach, many times those patients can't be taken care of in the home if they have a trach. So she has those conversations about what life could look like down the road, and we're not, you know, we don't know what could happen, but we at least have this conversation so she can prepare them that sometimes you might need to go to a skilled nursing facility afterwards. Those are things that you need to know because somebody may not have wanted that for themselves in their lives. So I think just really taking yourself out of the equation and making sure that what the person is telling you that they want to have done, that they understand it, that it's not a medical terminology that they don't understand. I think that's the most important point. Is what I would say, is just to make sure that they understand what they're really saying that they want.
That's great. I wonder if anyone has any other questions. You can put them in the chat. I'll share my own story. For my mom, when my dad was very ill and couldn't make his own decisions, she really struggled with the choices that she was faced with. And then one day she found the 5 wishes buried in the filing cabinet. And there it was in my dad's handwriting that said very clearly what his wish would be. And that lifted such an immense weight off of my mom's shoulders that it wasn't her making the decision, it was his decision. And that was such a gift that we should all be able to give to our families, to put our decisions down so that they aren't forced to make them.
Oh, that just gave me chills, Christina, when you said that. It's so true. I can only say that, you know, if you haven't experienced that before where you've had to make those decisions, and I didn't want our family to have to go through that because we have a very close family, and I didn't want my sister and I pulled, you know, apart if we didn't agree because we're very different people. And just making sure that we both heard what Dad wanted and have those things written down, because I have seen exactly what you said. It does really bring peace, a little bit of peace after, you know, really, sometimes a really difficult situation.
Terrible. Jackie, here's another question. I think 2 questions. The question written is, can you change your mind at the last minute? If you're still conscious, could EMS witness your statement? Or can you change your mind at all?
You absolutely can. You can change your advance directive at any time. You can change your MOLST at any time. And you can tell many times, my husband's an EMT, and so he'll tell me that they go into, you know, they'll go into a skilled nursing facility and the nurse will say, you know, here they have a MOLST or they have an advance directive. But the patient is saying, and they check, is the patient alert and oriented? Then they can, yes, they can say, I don't want to follow that. I want to be treated. So yes, it can be changed at any time.
Excellent. Well, 1 more minute if anyone has any other questions. Jackie, I again appreciate your passion and your expertise, and thank you for being here with us tonight. I hope, if nothing else, folks, you leave here with a seed to start a conversation. You can say, I saw this webinar and I heard this woman speak, and I wonder, what do you think about this? And it at least gives you a launching point. You don't have to make your decisions right away, but at least gets the conversation going. So we will be sending out Jackie's presentation that has the links, the conversation project information, which is a great resource to start, you know, gathered around the kitchen table or the picnic table. Now that we can all start to be gathering with our families again, it's a great time to have conversations like that. So Jackie, thank you again. And folks, thank you for being here with us. Doug, Mason-Dixon Mobile Medicine, thank you for sponsoring our program tonight, folks. Please jot down Doug's information and give him a call if you are looking for a healthcare provider that makes house calls. That's such a wonderful wonderful resource. Please save the date for June 10th is our next webinar, Navigating Emergencies. As Jackie said, we're going to continue this conversation a little bit. We're excited to have Christy Dutrow, who's the Assistant Director of Emergency Communications with the Frederick County Division of Emergency Management, and Matt Bergen, a paramedic, and with the Frederick County Division of Fire and Rescue. We'll talk about what happens. What do you need to know? What should you be prepared for, including more information about the red folders if you had an emergency and had to call 911. So again, mark your calendars for June 10th. You can start registering for that at any time on the same webinar link that you signed up for this one. We'll send that information out with Jackie's slides. So with that, I wish you all a very good evening. Enjoy the sunshine, and we'll see you next month. Thanks again, Jackie.
Thank you. Bye-bye.
Bye-bye. Hi.
Okay, we're all clear.
What do you think happened with the technology tonight?
I don't
That
know,
was-
because I was getting the same screen messages that Jackie was describing, and I had the PowerPoint open on my second screen. It was not recognizing it at all.
And not to have the functionality, like we've done so many of these, none of the settings have been changed. I don't know why.
Do you want to end the recording?
Oh, thank you. I can't do it. One of you has to do it.
Rayanne, you have to do it because you're the host.